Book 1. Unit 1, Dentistry. Exercise 5, page 5.
Dentistry, a dentist's job. Dentists deal with the oral health of patients. Oral health includes the teeth, gums, and other structures of mouth. Dentists diagnose and treat related medical issues. They give instruction on tooth and gum care. They offer advice on decisions impacting oral health. How to become a dentist. Dentists must earn a college and a professional degree. They also need a license from the state. Workplace. Dentists may work alone or share a practice. They often employ support staff. Prospects. The dental industry is growing. Jobs should increase by 21% during the next decade. This is in response to greater public demand.
Unit 2, Specializations. Exercise 5, page 7. Great smiles. Dentists, Drs. Alan Westhoven, Mary Engelbart, Eunice Kim. Come get the care and attention you deserve. Our office is supplied with the most up-to-date equipment. Our dentists have years of experience in general dentistry. They also offer expert knowledge in various specialties. Orthodontics. Braces are available for adults and children. Endodontics. Root canals. Periodontics. Treatment for gingivitis and gum disease. Prosthodontics. Prosthetics for patients with maxillofacial injuries. Dentures and dental implants are available. Pediatric dentistry. Care for infants, toddlers, and young children. Oral surgery. Wisdom tooth extractions, oral/maxillofacial pathology and radiology services are unavailable. Referrals are available for patients who require these services. Unit 3, The Dental Practice. Exercise 5, page 9.
Belleville, New Jersey Dental Clinic. For sale. Beautiful, modern, well-established office. Located on the second floor of a new building. 2 operatories supplied with new chairs. Spacious waiting room with a large reception desk. 1 fully equipped restroom. Also includes a small lab. Staff area is accessible from the lab. Comes with a radiology room and a sterilization room. 2 spare rooms are available. Enough space for a treatment room or recovery room. Storage room and mechanical room are in the basement. The doctor is relocating. She would like an immediate transfer of ownership. Asking price, $150,000. Willing to negotiate. Please email krobson34@gomail.com or call Dr. K. Robson at 973-342-3634.
Unit 4, Dental Personnel. Exercise 5, page 11.
Brighton Street Dentistry, Employee Profiles. Meet the staff at Brighton Street Dentistry. Our front office staff includes Jessica Parisi, receptionist, Luke Criswell, office manager, Joanna Volpe, financial coordinator. Our back office staff includes Dr. James Fitz, DDS, dentist, Mike Chan, dental therapist, Chrissy Wick, lab technician. We recently hired 2 new staff members, Tiffany Duarte, dental hygienist.
I just joined Brighton Street Dentistry. I work closely with Dr. Fitz. I handle teeth cleanings. I look forward to meeting each patient.
Chad Holmes, dental assistant.
I have 5 years' experience. My job involves assisting the dentist. I am excited about this new opportunity.
Unit 5, Dental Instruments. Exercise 5, page 13. DentiQuick. For all your dental supplies. Quick delivery, best prices. Dental mirrors. Simple stem, $7 or $22.50 for a pack of 6. C-probes. Single-ended, $8. Retractors. Sharp points, $47. Blunt points, $44. 2 sizes available. Aspirating syringe. Type CW. 1.8 cc. $14.50. Burrs. 6-pack. Rounded or egg-shaped. Various sizes. From $20. Double-ended excavators. Various sizes. $8 each or $7 for orders over 12. Double-ended burnishers. Number 21/22 and 27/29. $10 each. Pluggers. Double-ended round tips. $9. Stainless steel curettes. Double-ended, $9. Extraction forceps. Different models for molars, incisors, and anteriors. $25. Elevators. Various sizes. $12. Stainless steel chisel. 7-inch, $15.50. Dental handpieces, drills. Various speeds and sizes. Click here to see our range. Unit 6. The Mouth. Exercise 5, page 15.
The mouth. Chapter 1. The mouth is important for speech and breathing. It is also necessary for eating and digestion. The mouth includes soft tissues such as the tongue, soft palate, and gums. It also contains hard structures including the teeth, hard palate, and jawbones. Structures outside the oral cavity include the upper lip and the lower lip. These close the oral cavity when they rest together. At the back of the mouth is the uvula. It hangs from the soft palate. The uvula prevents food or liquid from passing into the nasal cavity. The tonsils lie on either side of the mouth beyond the palatoglossal arch. These are part of the immune system.
Unit 7. Tooth Anatomy. Exercise 5, page 17.
Anatomy of a tooth. A tooth is made up of many parts. Some parts are easy to see. The crown is visible. It sits above the gum line. It is protected by white enamel. Then there are the parts you cannot see. Dentin lies underneath the enamel. Inside that is the root canal. It is a space filled with pulp. Nerves and blood vessels run through the pulp. Below the gum line is the tooth's root. The crown and root meet at the neck. The root connects to the bone. The roots are covered in a hard substance called cementum. The periodontal ligament keeps the tooth in place by securing it to the bone.
Unit 8. Types of teeth. Exercise 5, page 19.
Types of teeth. Incisors. There are 8 incisors. They are at the front of the mouth. They are flat but sharp. Their job is to cut and chop food. Canines. Next are the 4 canine teeth. They are pointed. Their job is to tear food. Premolars. Next are the 8 premolars. They are larger and have ridges. Their job is to crush and grind food. Molars. Then come the 8 molars. The tongue moves food you chew backward. The molars then grind the food. After that, you can swallow. Wisdom teeth. There are 4 wisdom teeth. They grow in when you are older. They are removed if they are causing overcrowding in the mouth.
Unit 9. Personal Protective Equipment. Exercise 5, page 21. Guidelines on Personal Protective Equipment, PPE. The selection of PPE depends on medical hazards. Contact with blood and/or saliva requires PPE. In dental clinics, primary PPE is as follows: disposable surgical gloves, disposable surgical masks, goggles, face shields. These items protect medical staff from contaminants. Dentists and hygienists are at risk for infectious diseases. To prevent further contamination, properly dispose of PPE. The following provides the procedure for the removal of PPE. First, remove surgical gloves. Next, remove face shields/goggles. Finally, remove surgical masks. Place goggles and face shields in dispensers. They are reusable. Be sure to wash your hands immediately afterwards. Use antibacterial soap and warm water. Lather hands and rub for 1 minute, then rinse. Unit 10. Dental Practice Technology. Exercise 5, page 23.
New Dental Care Technology by Stephen Murphy. Dr. Sharon Kelly's office has the latest technologies. Every workstation uses a computer, and each computer has voice data entry software. Systems operate on wired and wireless networks. Flat-screen monitors are located throughout the office. These monitors display digital X-rays and intraoral camera images. Lasers and air abrasion are used as alternatives to traditional drilling. In addition, CAD and CAM programs help the dental restorations. Information technology and clinical technology are essential, says Dr. Kelly. Every bit of hardware is put to good use. These days, it's far easier to treat patients thanks to new technology.
Unit 11. Patient Scheduling. Exercise 5, page 25. Moraball Dental. Thank you for choosing Moraball Dental. Your dental health is our priority. Our business hours are from 9 a.m. until 6 p.m. We are open every weekday except Wednesday. Evening and weekend appointments are available upon request. To schedule an appointment, please call 555-501-5521. Our receptionists will be happy to help you. We are usually unable to accept walk-ins. Call to reschedule an appointment date or time. We will do our best to accommodate you. We require 24 hours notice to cancel appointments. We also charge a fee for no-shows. Unit 12. Insurance and Fees. Exercise 5, page 27.
Office Policy. Dear patient, we appreciate the opportunity to care for you. The following information outlines our financial policy. Please provide full insurance information before treatment. We need authorization to accept insurance payments directly. Co-payments are due immediately following appointments. We can help you to process your claim. Your insurance may not cover some services. In such cases, costs are the patient's responsibility. We offer financing to patients without insurance. Talk to our financial coordinator about payment plans. We take cash and personal checks. We also accept most major credit cards. Unpaid balances are subject to interest and fees.
Unit 13. Chairside Manner. Exercise 5, page 29.
How to improve your chairside manner. Dental visits make many patients nervous. Working on your chairside manner can help them. Good communication is vital. Always make eye contact with patients. Ask them open-ended questions about their health. Then really listen to their answers. Do not interrupt them. Let your patients explain their concerns. Then sympathize with those worries. Patients appreciate this and you gain more information. Better communication allows you to customize examinations. Patients want a dentist who cares. Pay attention to both verbal and nonverbal cues. Patients may not admit to being scared. Nonverbal cues tell you when to provide reassurance. Remember that you want patients to feel comfortable.
Unit 14. Oral Health. Exercise 5, page 31.
Your Guide to Oral Hygiene. Here's what you can do to ensure a lifetime of healthy teeth and gums. Brush regularly. Brush your teeth at least twice a day. Use a soft, bristled toothbrush and use toothpaste containing fluoride. Fluoride strengthens the teeth and prevents tooth decay. Use floss. You should clean between your teeth using floss. Do this daily to prevent the buildup of plaque. Use mouthwash. After eating, bacteria accumulates in the mouth. This, in turn, can cause plaque. If plaque is not removed, it combines with sugars and forms acids. This can cause tooth decay. Stop harmful bacteria by using a good mouthwash.
Unit 15. Dental Cleanings. Exercise 5, page 33. Prophylaxis, Chapter 11. Most people refer to prophylaxis as dental cleaning. It involves removing plaque and tartar from the teeth. These deposits build up in the mouth over time. Prophylaxis involves 3 or sometimes 4 steps. The summary below outlines these steps. 1. Removal of large deposits. Dental hygienists commonly use ultrasonic instruments. These remove larger deposits. 2. Removal of fine deposits. This involves using fine tools to scrape away small tartar deposits. 3. Polishing. The hygienist now cleans and polishes the teeth by applying prophylaxis paste. 4. Fluoride application. This optional step involves the application of fluoride. Patients must not eat this, they must spit it out. Book 2. Unit 1. Dental Exam. Exercise 5, page 5. What to expect during a dental exam? There are 2 types of dental exams. There are comprehensive examinations and checkups. First-time patients usually receive comprehensive examinations. Expect your dentist to examine your head and neck. Your dentist is likely to inspect the soft tissues. This includes the tongue, lips, and inside of the mouth. Your dentist also evaluates your gums. The goal is to diagnose the presence of gum disease. He or she will also look for signs of decay. This is also the time to check restorations. Your dentist may examine your bite. This is to check for occlusion problems. X-rays may be part of a comprehensive examination. A checkup is less thorough. It involves an exam and a tooth cleaning and polishing. Your dentist may take X-rays. Regular checkups maintain your oral health. They allow your dentist to screen for diseases like cancer. Your dentist will discuss any oral issues with you. Unit 2. Radiography. Exercise 5, page 7.
http://www.mydentalclinic.com. Dental radiography helps diagnose and treat dental problems. X-rays can detect cavities and impacted teeth and monitor tooth development. X-rays also help dentists fit prosthetics or braces. Intraoral radiography is most common. It includes the following. Occlusal X-rays show tooth development and placement in an arch of teeth. Bite wing X-rays show hidden areas between upper and lower teeth to detect decay. Periapical X-rays show an entire tooth from root to crown to find abnormalities. Extraoral X-rays focus on the jaw and skull. They often identify problems with individual teeth. Examples include the following. Panoramic X-rays show the entire mouth. Tomograms, used to examine structures that are hard to see. Cephalometric projections show an entire side of the head. Computed tomography identifies tumors and fractures. Exposure to radiation sometimes leads to health risks. The risk of exposure can be prevented or minimized. Patients can wear lead aprons or lead collars during X-rays.
Unit 3. Dental Prosthetics. Exercise 5, page 9.
Dental prosthetics. Prosthetics are common in general dentistry. Patients with missing or damaged teeth require artificial replacements. Dentists use numerous materials and appliances as substitutions for real teeth. One type of prosthetic is a crown. Crowns are usually fixed and made of metal and/or porcelain. Dentists often use them to help strengthen existing teeth. However, sometimes crowns are used to replace missing teeth. More often, bridges and implants replace missing teeth. Bridges cover a row of lost teeth. They are usually removable. Implants, on the other hand, are fixed. Dentures are another common dental prosthetic. They are suggested for patients who are missing all or most of their teeth. Partial dentures are for those who need to replace missing teeth in an arch. Veneers are fixed cosmetic prosthetics. They are made of porcelain or plastic. Dentists use them to improve discolored, crooked, or slightly chipped teeth.
Unit 4. Orthodontic Treatment. Exercise 5, page 11. Do you need orthodontic treatment? Many people suffer from problems of teeth alignment, known as malocclusions. These can cause headaches, tooth decay, and can affect your appearance and confidence. If your teeth stick out too far, known as overbite, not far enough, underbite or crossbite, or don't meet properly, open bite, don't worry, we can fix it. What sort of treatment can I expect? The type of treatment depends on the type of deformity. The most common fixed appliance is braces. If a child has lost baby teeth early, we may fit space maintainers. If your lips and cheeks are putting pressure on the teeth, we may fit bumpers. We may fit a palatal expander to widen the arch of the upper jaw, or retainers to keep the teeth in their new position. Or we may fit headgear to align the upper and lower jaws. For more information, book now for an appointment with one of our orthodontists. Unit 5. Dental Caries. Exercise 5, page 13.
Catch dental caries before it's too late. Stage 1. Slight. Acid produced by sugar-loving bacteria in plaque start to erode tooth enamel. This leads to the formation of small cavities in pits and fissures in the biting surfaces of teeth. At this point, there are no symptoms. The cavities are painless. Stage 2. Minor. The cavity deepens until it reaches the underlying dentin, and then it begins to spread. The patient will begin to feel some sensitivity when eating hot, cold, or sweet foods and drinks. Stage 3. Advanced. The cavity spreads further and begins to weaken the tooth. There may be some discoloration and pain. Stage 4. Severe. The tooth is now very weak. Fractures may develop when biting down, especially if the cavity is under a filling. The tooth may break altogether. Root canal procedures are necessary to prevent the spread of infection in the dental pulp.
Unit 6. Fillings. Exercise 5, page 15.
Getting a filling. What's going to happen? First, the dentist will numb the area with a local anesthetic. The dentist will then use a drill to remove the decay. He or she will probe and clean the area to check all the bacteria and decay has gone. If the decay is deep, the dentist will apply glass ionomer to fill the area. Then the dentist will add the filling material in layers, using a special light to cure each layer. Then the dentist will shape the material and polish the final restoration. What will the dentist use to fill my tooth? Several materials are available, including gold, ceramic, silver, or amalgam. There are also composite resin fillings made from plastic and glass. Will I need more than one appointment? Dentists make most fillings in one appointment, but indirect fillings require 2. You will receive a temporary filling on the first appointment and your permanent filling on your second visit.
Unit 7. Root canals. Exercise 5, page 17.
Your Guide to Root Canal Surgery. The Park Road Practice, 60 to 62, Park Road, Swinburne. Why do I need a root canal? Your tooth is badly infected and you may have an abscess. You are probably experiencing toothache and swelling around your tooth. This will stop after the procedure. How did it get infected? Maybe bad tooth decay exposed the pulp to bacteria, or you received trauma to the tooth, for example, from a heavy blow. What will happen? The dentist will fit a dental dam to keep the area free of saliva. He will then make an opening through the tooth to access the pulp chamber and remove the diseased pulp. Then he will irrigate the pulp chamber and root canal to disinfect them. Then he will seal the area with gutta percha and fill it as normal. How will the dentist restore my tooth? Your dentist may fit a crown onto your weak tooth. Teeth which have had a root canal will have a post to give it extra support. Will I need drugs? The dentist may prescribe antibiotics to prevent infection.
Unit 8. Extractions. Exercise 5, page 19.
Chapter 9. Exodontias. Exodontia is the formal term for a dental extraction. Dentists perform exodontias for a number of reasons, including tooth decay. The extraction of impacted wisdom teeth is also commonplace. 2 categories of extraction include simple and surgical extractions. Dentists perform the former on visible teeth. The dentist simply uses forceps to grasp the tooth, rock it back and forth to loosen it, and remove it. Inaccessible teeth require surgical extractions. These usually require an incision. The dentist elevates the soft tissues covering the tooth and jawbone with a drill or osteotome. He or she may section the tooth into multiple pieces to remove it. Bleeding is common after extractions, but usually decreases after an hour. The open wound takes about a week to heal. Minor complications include infection, swelling, and bruising. Dry socket may follow the removal of lower wisdom teeth. This occurs as a result of poor blood supply to the area.
Unit 9. Gum disease. Exercise 5, page 21.
Gum disease. Many adults suffer from periodontal disease in some form. The mild form of gum disease is gingivitis. Your gums may get swollen and bleed easily. Cleaning regularly can stop this getting worse. If you don't keep your teeth clean, the problem may advance to periodontitis. This causes gums to recede from the teeth. The patient may suffer from halitosis. Spaces form around the teeth called pockets. Eventually, the teeth become loose and can fall out. How do dentists treat gum disease? Dentists can perform deep cleaning procedures to halt gum disease. Scaling removes tartar above and below the gum line. Root planing removes rough spots on the tooth root. The dentist may prescribe medications such as gels and antibiotics. If these do not work, you may need surgery. Flap surgery involves lifting the gums to remove tartar beneath. A bone graft or tissue graft may be necessary if there is a loss of bone or tissue.
Unit 10. TMJ Problems. Exercise 5, page 23. TMJ Syndrome. Future Advances in Diagnosis and Therapy. Journal of Dentistry, Issue 57, Volume 3. K. A. Duncan, N. Willis, and K. R. Stratham. Introduction. The temporomandibular joint, TMJ, connects the mandible to the temporal bone. Muscles in this joint allow mastication and speech. The jawbone moves in 3 ways. Hinge action allows the mouth to open and close. Gliding action allows the mouth to widen. Rotation allows it to move in a circular motion. Chewing creates a strong force, but a soft disc of cartilage in the TMJ absorbs and distributes the shock. Problems can arise in the TMJ, including pain in the jaw, head, face, ears, or neck. The jaw can lock in position or become difficult to open and close. The sufferer may hear a pop or a click when biting and chewing. He may also feel dizzy or nauseated. There are several causes of TMJ syndrome. First, internal trauma, including bruxism and clenching the jaw, can change tooth alignment and inflame muscles. Macrotrauma can damage the cartilage disc or dislocate the jaw. Osteoarthritis and rheumatoid arthritis can also erode the bone, causing TMJ syndrome. Unit 11. Oral Infections. Exercise 5, page 25. Painful mouth sores are a sign of infection. But what type of infection is it?
www.myoralhealth.com. My tongue is red and sore. It's probably a bacterial infection, like scarlet fever. Your doctor can treat this with antibiotics. I have white ulcers with red edges on my tongue. Maybe it's herpes simplex. This is a chronic viral infection, and it's very contagious. Cold sores are a sign of mild herpes. You may get similar ulcers if you have measles or chickenpox. Medication is available, but the problem can recur. There are white spots inside my lip. It sounds like the fungal infection thrush. It can be treated with antifungal medication. I've got painful ulcers on the roof of my mouth. Canker sores like these result from a virus or stress. They disappear after about 2 weeks. I've got blisters inside my cheeks and they keep popping. Vesicles and bullae like these are symptoms of disease and require a consultation with your doctor.
Unit 12. Oral Cancer. Exercise 5, page 27.
Oral cancer. What you need to know. What is it? Cancer is the uncontrollable growth of cells in the body. These invade in any part of the mouth. What are the symptoms? Oral cancer appears as a growth or sore that does not go away. Sufferers may have rough, eroded crusts or speckled patches in the mouth. They may have difficulty chewing or swallowing. They may also have a sore throat. How do professionals diagnose it? During your checkup, your dentist will check for the cancer symptoms. If he sees anything suspicious, he may conduct a brush biopsy. This involves taking a small sample of the tissue and analyzing it for abnormal cells. Alternatively, a specialist will carry out a scalpel biopsy to find out if the growth is cancerous. How can we treat cancer? Surgeons remove the tumor. Then the patient receives radiation therapy or chemotherapy to destroy any remaining cancer cells.
Unit 13. Oral and Maxillofacial Surgery. Exercise 5, page 29. Andrew Price, DDS, Oral and Maxillofacial Surgeon. Dr. Price can perform the following procedures. Wisdom tooth removal. Wisdom teeth may grow sideways or remain trapped beneath the gum and bone. Poorly positioned and partially erupted teeth can cause cysts and infections to develop, affecting healthy teeth. Removal of wisdom teeth will eliminate such problems. Facial trauma. Dr. Price is a skilled oral surgeon, trained in treating injuries such as lacerations, avulsed teeth, and fractures. Sinus grafts. When upper teeth are removed, a sinus graft may be necessary to hold dental implants in place. In severe cases, Dr. Price will conduct a ridge expansion to increase the dimensions of the bony ridge of the jaw. Sleep apnea. Dr. Price can perform a uvulopalatopharyngoplasty, UPPP, to treat this condition. In more complex cases, orthognathic surgery is recommended. Cleft lip and palate. Dr. Price is qualified to surgically treat cleft lips and cleft palates. Dr. Price has had great success in improving the appearance of the mouth and restoring its functions. Unit 14. Anesthesia. Exercise 5, page 31.
Common anesthetics in dentistry. Dental anesthesiology offers patients and medical professionals numerous choices for treatment. These choices are based on procedures. Most dental procedures only require a topical anesthetic or local anesthetic. Benzocaine and lidocaine are the most common examples of both. Benzocaine is produced as an ointment gel. Dental care professionals apply it to the gums. It numbs a small area in the mouth. Lidocaine is the liquid. Dentists inject it into the gums. It is capable of numbing an entire section of the mouth. Benzocaine helps prepare an area for a lidocaine injection. Dentists use general anesthetic for more serious procedures, such as surgery. General anesthetic causes a patient to become unconscious. In some cases, intravenous liquids are administered during general anesthesia. Sedation is not always necessary. In these instances, nitrous oxide is a good option. Nitrous oxide, or laughing gas, is inhaled. It acts as a block on the nervous system. The patient remains awake during procedure but feels no discomfort.
Unit 15. Medication. Exercise 5, page 33. Dentistry and medication. There are several types of medications used in dentistry. Most help to treat pain and infections. Pain medication. Over-the-counter pain relievers, including acetaminophen and ibuprofen, treat minor toothaches. Corticosteroids relieve discomfort and redness in the mouth. For severe pain, narcotics such as muscle relaxants are available by prescription. Treatments for infections. Antibiotics, such as penicillin, can help prevent infections after dental procedures. Chlorhexidine helps to control plaque and prevent gingivitis. Side effects may include tooth discoloration. Tetracycline helps to treat periodontal disease. Antifungals help to treat thrush, or yeast in the mouth. Some medications can prevent dental problems. Fluoride toothpastes, for example, help patients avoid dental cavities. Prescription-strength fluoride is also available if recommended by a dentist. Antiseptic rinses can reduce plaque and kill bad breath germs. Lastly, saliva substitutes such as pilocarpine treat dry mouth. Dry mouth leads to growth of bacteria. To help with this, various sprays and pilocarpine tablets are available. Book 3, Unit 1, Dental Emergencies. Exercise 5, page 5.
Peacehaven Dental Clinic. Accidents and emergencies. Accidents happen, and we realize that we need to be there for you when one occurs. We have reserved a daily slot for accidents and emergencies from 10 a.m. to midday every weekday. Call us for an appointment, giving as much detail as possible about your condition. If your dental emergency happens at the weekend or after 6 p.m., when we are not available, there are several steps you can do yourself. These could make the difference between saving and losing a tooth. If your tooth gets knocked out, keep it moist. After rinsing the tooth off, try placing it back in the socket. Avoid touching the root. If that's not possible, keep the tooth in your mouth, between your cheek and gums. Alternatively, place it in whole milk or a preserving product. Then go straight to the hospital emergency room. If your tooth is cracked, rinse the mouth with warm water. Put a cold compress on your face to reduce swelling. If an object is stuck in your teeth, remove it using floss. Never use anything sharp to remove stuck objects. If you receive a burn to the mouth, get medical attention immediately because swelling could restrict breathing.
Unit 2, Cosmetic Dentistry. Exercise 5, page 7.
Temple Cosmetic Dentistry. We've just opened our new cosmetic dentistry office on Temple Road. While traditional dental clinics focus on treating oral disease, our clinic focuses on elective treatments. Afterwards, you'll be feeling beautiful and confident about your smile. Our treatments include bonding. We can repair chipped, broken, or discolored teeth using our bonding procedure. The dentist may perform an enameloplasty to reshape the teeth. Then he will apply a composite material which resembles enamel. This will be sculpted and contoured to create a perfect, healthy-looking smile. Teeth whitening. Remove those ugly stains from smoking, food, coffee, and wine. Gingivoplasty. Reshape the gums around the teeth to promote a fresh, healthy smile. Smile makeover. Our dental consultants will give your smile a complete assessment and suggest ways to improve its appearance. Typically, several procedures will be recommended to achieve a dazzling new look. Full mouth reconstruction. While consulting you about your smile makeover, we may recommend treatment to correct functional problems with your bite and bone structure. If treatment is necessary, you can be assured that you will receive durable, clinically sound treatments to ensure your perfect smile lasts for a long time.
Unit 3, Pediatric Dentistry. Exercise 5, page 9.
Langham Pediatric Dentistry. At Langham Pediatric Dental Clinic, our focus is to provide dental care throughout the various stages of childhood, from birth to adolescence. We have worked hard to create a pleasant, kid-friendly environment. Gaining the trust and confidence of your children is very important to us. Our specialist treatment includes risk assessment for caries, preventative care and advice about cleaning and diet recommendations, counseling for habits such as pacifier use and thumb sucking that are harmful to teeth, early assessment and treatment for straightening teeth and correcting an improper bite, repair of tooth cavities, care for dental injuries such as fractured, displaced, or knocked out teeth. Our dentists, Dr. Malcolm Langham, DDS. Dr. Langham is a graduate from the University of North Carolina School of Dentistry. He completed 2 additional years of training in dentistry for children with special needs. In his spare time, he enjoys cycling and hiking. Dr. Mimi Mueller, DDS. Dr. Mueller graduated from Harvard School of Dental Medicine and completed her residency in pedodontics at Springville Children's Hospital. She enjoys cooking and reading in her free time.
Unit 4. Geriatric Dentistry. Exercise 5, page 11. The Importance of Population Statistics in Dentistry by Neil Sedgmore. Currently, almost 15% of the American population is over the age of 65. By 2040, this figure is estimated to increase to 23%. Some rural and coastal regions already have a higher proportion of seniors than this. Dentistry is one of many industries affected by the aging population. Professionals who specialize in geriatric dentistry are already much in demand. A number of dental issues are specific to elderly patients, whether they are edentulous or retain their own teeth. One common problem is xerostomia, or dry mouth. This often results as a side effect from taking medications. Dry mouth can affect a person's ability to speak, taste, and eat. They may be in more pain, and gum disease can develop faster. Older patients suffering from diabetes mellitus are at greater risk of oral infections. It is also believed that systemic diseases, such as osteoporosis and diabetes, can lead to periodontal diseases. Clinics in areas with large elderly populations need to bear a number of things in mind. It's not enough just to hire dentists who have specialized in geriodontics. Appropriate equipment, such as wheelchair-accessible chairs, is necessary. Clinics should also consider investing in a mobile unit in order to visit patients in nursing homes. Unit 5. Nutritional Counseling. Exercise 5, page 13.
Chapter 24, Nutritional Counseling. In some situations, it may be necessary to counsel dental patients regarding nutrition. This is necessary if a patient is suffering from recurrent decay, periodontal disease, or early childhood caries. These conditions indicate a high consumption of junk food, such as chips and candy. Mothers may need nutritional counseling if babies are suffering from baby bottle syndrome. That is, if they are allowed to sleep while sucking on a bottle containing sugary soft drinks. A formal or informal approach can be taken to counseling. Informally, the dentist can use visual aids and brochures to discuss their general attitude to food. The dentist can ask the patient for a 24-hour food recall. A formal approach might involve asking the patient to record a weekly food diary. If there is an underlying medical condition affecting food intake, such as nutrient deficiency disease, the dentist should refer the patient to a dietitian. In all cases, the patient's lifestyle must be taken into account. Be aware of cultural influences that affect diet. Consider the patient's level of education and current health status. Finally, be sensitive towards the patient's financial status. This may put restrictions on the type of food they consume.
Unit 6. Patient Referrals. Exercise 5, page 15.
Park Hill Practice, Guidelines for Referring Patients. Dentists have an ethical obligation to make arrangements for any necessary care for their patients. In some cases, primary care dentists may need to refer patients to a specialist. The primary care dentist is known as the referring dentist. He or she coordinates with the consulting dentist. This ensures that the role of each dentist is clear. Patients may visit or be referred to specialists for consultations. Upon completion of their care, specialists should return the patient to the care of the referring dentist. The exception is if the patient reveals a preference for a different dentist. A dentist could be held liable for poor treatment performed by a consulting dentist. Therefore, referring dentists must assess the qualifications of consulting dentists before issuing a referral. In some cases, a specialist may be asked to give a second opinion regarding treatment or diagnosis. The dentist giving the second opinion should give an objective recommendation. Dentists must not unjustly imply that a patient has been mistreated. It can be difficult to determine whether or not such comments are justifiable, but it is possible to conduct an inquiry using the proper channels.
Unit 7. Patient Health History. Exercise 5, page 17.
Patient Health History Questionnaire. Personal information. Full name, Benjamin Michael Dodson. Date of birth, February 3, 1962. Address, 4520 West Smith Street, Sarasota, Florida, 34231. What is the best phone number for us to reach you? 941-435-6734. What is the reason for today's visit? Checkup and cleaning. Medical information. Who is your primary care physician? Dr. Robert Unger. Primary care physician's address, 3462 East Portland Avenue, Sarasota, Florida, 34246. Primary care physician's phone number, 941-454-5473. Date of your last physical examination, February 23, 2013. Have you ever had a serious illness, operation, or been hospitalized? If so, please explain. Yes, last year I was hospitalized after a car accident. I had a broken leg and several broken ribs. Have you ever had an allergic reaction to food, medication, or latex? Yes, mushrooms give me a rash or fever and minor swelling. Have you ever been treated for mental health problems? If so, please explain. No. Are you currently taking any medications? If so, what is your dose frequency? Yes, I am taking medication to help regulate my blood pressure. I take it once a day. Do you use tobacco? No. Do you drink alcohol? If so, how frequently? Yes, I drink wine twice a week. For women, are you pregnant?
Unit 8. Chronic Illness. Exercise 5, page 19.
Oral health and chronic illness. The connection. You know that good oral health is important, but did you know it affects more than just your mouth? Research shows a link between poor oral health and chronic illnesses. Increasingly, doctors and dentists are taking a holistic view of patient health. The mouth provides vital information about the body and vice versa. Links with diseases. Patients with gum disease double their chances of getting heart disease. There is a correlation between tooth loss and stroke risk. There is also an association between bad oral health and kidney disease. Diabetes is a bit more complicated. There is a two-way relationship between diabetes and gum infections. Research suggests that diabetics are more prone to gum infections. In addition, gum infections are a contributing cause of prediabetes. Inflammation in the mouth reduces the body's control over blood sugar. Claims have been made about a connection between osteoporosis and gum disease. However, This is still unverified. What does this mean for you? It is more important than ever to update your dental files. Let us know if you have a family history of chronic illness. Also inform us if you receive a new diagnosis. We need the complete picture to offer you the best care.
Unit 9. Special Needs Patients. Exercise 5, page 21. Treating special needs patients. General dental practices often need to treat special needs patients. There are not enough specialized dentists to handle this population. Some dentists doubt their ability to treat people with disabilities, but general practitioners can usually work around mild to moderate disabilities. Who is a special needs patient? Special needs patients require a change to the standard treatment approach. There are many people who fall into this category. Not all of them have severe handicaps. Some of these patients may have physical limitations. These can range from minor mobility issues to a developmental disability. Mentally ill people may be special needs patients. No two special needs patients are the same. Forget about stereotypes and focus on the individual. How to provide appropriate care for this population. Good dentists have certain characteristics. They show compassion and understanding. They treat patients with respect. This approach is even more important for special needs patients. Ask about the patient's condition before their appointment. If necessary, research it so you are aware of factors that might affect treatment. Think about the best ways to accommodate them. Be flexible with scheduling and keep appointments short. Many dentists worry about seeing special needs patients. However, this population needs dental care too. So forget about the fear and concentrate on your training. Unit 10. Patient Anxiety. Exercise 5, page 23.
Green and Jessup Dental Practice, Warner Road, Pelham. Do you experience anxiety visiting the dentist? If so, you are not alone. 75% of people surveyed find dental visits stressful, and up to 10% have a real phobia. This leads to a cycle of avoidance, where people only seek dental help in emergencies. Such emergencies require invasive treatment, and this reinforces their fears. You may be anxious because of a direct experience. Perhaps you had painful surgery in the past, or it could be based on indirect experience. Maybe friends have recounted traumatic dental experiences and you developed a fear through vicarious learning. Or you could have read or heard stories in the mass media. Many stories and films depict dentists as cruel, with patients undergoing treatment in a state of helplessness. Such stimulus generalization inevitably results in trauma. We at Green and Jessup Dentistry want to help you feel positive and relaxed about your visit. That's why all our dentists practice the tell, show, do technique. This is proven to help patients feel relaxed and in control. If you feel anxious during your procedures, please talk to your dentist.
Unit 11. Communicating with patients. Exercise 5, page 25.
Patient Communication by Dr. Emily Lucas. As a dentist, I'm most concerned about doing my job properly. I need to treat patients' teeth in the best possible way. But competence is not the only quality a dentist needs. Dentists must also be caring. They must be compassionate towards their patients. Only this way will patients have true confidence that the dentist wants to help them. How can dentists show their patients that they care? Well, first off, you don't have to rush into treatment as soon as the patient arrives. Take time to chat. Show an interest in their lives. Ask them about their hobbies or compliment them on their appearance. Don't just give a general compliment like, "You look nice today." Point out something specific like a bright sweater or a new haircut. Be honest and maintain eye contact. This will show patients that you are confident and self-assured. At the end of the appointment, write down what you learned about the patient during your conversation. Patients are always appreciative if you can remember details about their lives and accomplishments. By following these steps, you will see a huge improvement in dentist-to-patient interaction.
Unit 12. Sustainability in Dentistry. Exercise 5, page 27.
Many dental practices are taking measures to improve sustainability. By doing so, they are reducing the impact the dentistry profession has on the environment. If you are interested in making your dental practice more eco-friendly, here are some things to consider. Use of electronic health records saves paper, not to mention space. Also, try to file electronic insurance claims for your patients to reduce paper waste. Implement digital radiography. You won't have to dispose of the fixer and developer needed to develop traditional X-rays. Invest in an amalgam separator to prevent harmful mercury from entering the practice's wastewater. Amalgam is not separated at wastewater treatment facilities. As a result, it may be released into public water supplies. Choose energy-efficient machinery and low-flow water fixtures whenever possible. You'll lower your consumption of natural resources and save on utility bills. Recycle as much as possible. Materials that instruments are wrapped in, such as paper and plastic, can be recycled. In addition, some materials such as amalgam and lead foils for X-rays can also be recycled. Dispose of hazardous waste properly to avoid pollution of land and water. These are just a few things you can do. There are numerous ways to make your practice more eco-friendly. Visit www.greendentist.com/sustainability for more information.
Unit 13. Obtaining licensure. Exercise 5, page 29.
All dentists are required to obtain licensure to practice dentistry. Candidates for licensure apply to a governing agency in the location where they want to practice. Licensure requirements can vary from place to place, but usually there are 3 basic requirements. These are an education requirement, written exam requirement, and a clinical exam requirement. A board usually sets forth the requirements for licensure. It also determines if a candidate should be issued a license to practice dentistry. In some places, dentists may also have to apply for specialty licensure. It allows them to practice in the specialty fields of dentistry, such as orthodontics or prosthodontics. Specialty licensure requirements may include passing a specialty clinical exam. Specialists may also need to provide proof of additional education in the specialty area. If a dentist relocates, he or she may have to get a new license specific to the area through the local licensure authority. In most cases, this does not require meeting any additional requirements. In addition to issuing licenses, agencies can also take them away if dentists are shown to have engaged in misconduct. They are in charge of disciplining dentists whose behaviors are not suitable for a member of the profession.
Unit 14. Establishing a dental practice. Exercise 5, page 31. After completing their studies, new dentists are faced with a choice. Do they start up their own private practice, or do they find employment with an existing practice? If having your own practice is what appeals to you, here are some guidelines to help you on your way. Talk to dentists that establish their own practices. They can give you ideas about what kind of capital is needed to start your practice. Ask about banks that can provide funding for your endeavor. Also solicit advice on drawing up a successful business plan. You will need one when applying for loans. After obtaining funding, decide if you are going to rent a space in a building or build your own office. Apply for any necessary business or building permits from your local government agencies. Next, purchase equipment and hire staff for your practice. Advertise job vacancies in the newspaper or on internet job boards. Have a staff orientation before opening so you can discuss your expectations with them. Finally, you'll need to market your practice to potential patients. Run ads on radio stations and television, and offer discounts to patients who give word-of-mouth referrals. Also consider hiring a web designer to create a website for your practice. Unit 15. Ethics in Dentistry. Exercise 5, page 33.
Dentists have a code of ethics that governs how they should act. There are 5 principles in the code which dentists are expected to uphold. The first principle is patient autonomy. Patients have the right to accept or refuse treatment after a dentist informs them of what is needed. Also included in this principle is confidentiality. Dentists must keep details about their patients' treatments private. The second principle is non-maleficence, or do no harm. Dentists should keep their education current and train in new procedures to provide the best care to patients. They also must consult with or refer patients to specialists for diagnoses out of their range of knowledge. The third principle is beneficence, or do good. Dentists are required to promote the welfare of patients and people in general. Under this principle, they are expected to report any abuse or neglect of their patients to authorities. They are also encouraged to engage in community service. The fourth principle is justice, which ensures fair treatment of patients. Dentists may not refuse to treat patients based on race, gender, nationality, or color. The fifth principle is veracity. Dentists must be honest and demonstrate integrity in their dealings with patients and insurance companies. They cannot make false claims regarding fees or treatments.
AVN Pharma Education.